Hi, I am Dr. Kavita. Please to watch, share, subscribe to my channel. Today I am going to tell you about genetic screening in children. Genetic screening in children involves testing to detect signs of disease or risk factors for developing future health problems. This type of testing has advanced significantly and is increasingly common in pediatrics. Reasons for genetic screening in children. First one, diagnosis of suspected conditions. Genetic testing can help diagnose genetic disorders, especially in children with complex medical presentations or neurodevelopmental disorders like autism spectrum disorder. It can identify which genes are involved and help tailor treatment. Second one, early detection for intervention. Newborn screening tests babies in their first days or weeks for certain conditions, often before symptoms appear. Early detection can allow for prompt treatment and interventions to prevent or reduce the effects of life-threatening genetic conditions. Third, family history of genetic conditions. Screening may be conducted for healthy children with a family history of a genetic condition, particularly if early treatment could make a difference. Carrier status. Genetic screening can determine if a child is a carrier for a gene linked to genetic disorder that could be passed on to their future children. However, testing for carrier status is typically delayed until the child is old enough to consent, unless the results impact their care before adulthood. Types of genetic screening methods. Genetic testing typically involves collecting a blood or saliva sample. The samples are then analyzed in a laboratory. Types of genetic tests include: first one, chromosomal microarray analysis. This screening looks for missing or extra pieces of genetic code that can cause neurodevelopmental disorders. Next is whole exome sequencing, WES. Whole exome sequencing. This method is increasingly used for children with diverse medical presentations and offer a higher diagnostic yield compared to previous methods, leading to more targeted medical management. Third one, whole genome sequencing. This is the most comprehensive type of genetic testing, examining all of a child's DNA. It is often available through research studies due to its extensive nature. So, what are the reasons for genetic screening in children? To diagnose some suspected conditions, for early detection, for intervention, to reveal the family history of genetic conditions, to assess the carrier status in genetic screening. What are the types of genetic screening methods? Chromosomal microarray analysis, whole exome sequencing, whole genome sequencing. Important considerations. Parental consent. Parents must provide consent for genetic testing in young children. Delayed testing for certain conditions. Testing for conditions that typically appear in adulthood, for example, some cancers, is generally not recommended during childhood. Similarly, testing for carrier status is usually deferred until the child can give their own consent, unless it affects their immediate care. What are the ethical considerations? There are ethical and policy considerations regarding genetic testing in children, as highlighted by various health organizations. Thank you. Medical students, what do you read about? What is genetic screening in children? What is the aim and objective of genetic screening in children? What are the reasons for carrying out genetic screening in children? How do we reveal family history of genetic conditions in children with the help of genetic screening? What are the types of genetic screening methods? What is chromosomal microarray analysis? What is whole exome sequencing? What is whole genome sequencing? How do we acquire a parental consent for genetic testing in young children? How do we delay testing or genetic screening for certain conditions in children? What are the ethical considerations for genetic screening? How does early genetic screening affect long-term health outcomes in children? What are the ethical considerations of testing children for genetic carrier status? Why do some experts recommend delaying certain genetic tests until children are older? What advancements are currently making genetic testing more accessible for children? Thank you. Please do subscribe to my channel.